Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, it's Dr. Nancy O'Hara, and I'm thrilled to welcome Dr. Erica Peirson to our podcast. She's a naturopathic physician who's been practicing for 18 years, and the birth of her son and her 14 years working at Shriners Hospital for Children throughout undergraduate medical school really inspired her to specialize in optimizing the health of children with neurodevelopmental and genetic conditions. She's lectured nationally, internationally to share with others the many ways she optimizes the health of her own patients and her family. She sees patients from all over the world through her private telemedical practice. And she's also the proud mother of a healthy, thriving 17-year-old who just happens to have mosaic Down syndrome and has benefited from her expertise. And, you know, Erica, we've all benefited from your expertise. So thanks for being here.
Thanks, Nancy. I appreciate it.
You and I have lectured together, and I've also been excited to read several of the articles and watch other podcasts you've done, and blogs on Down syndrome, and especially PANS and PANDAS in Down syndrome. And I'd really like you to talk a little bit about how PANS and PANDAS typically presents in children with Down syndrome and the unique challenges that arise in recognizing and diagnosing the conditions in that population of kids.
Yeah, there definitely can be some challenges. At the core of it, you could say the signs and symptoms are the same, right? The anxiety, the sensitivity issues, the OCD, maybe the sudden onset, maybe some urination issues, etc. Food sensitive, all of it, right? They can definitely experience all of the signs and symptoms. But due to their kind of unique developmental trajectory, right? Many of them, without having PANS and PANDAS, are already experiencing some of these things. So, food sensitivity issues, sleep difficulties, right? Without having PANS and PANDAS. I'm not going to go into all the underlying causes of that baseline for many children, because many of that is, there are actionable things to do about that. So that when the onset of PANS and PANDAS happens, it just looks like an aggravation of their baseline state, or what often happens is, as PANS and PANDAS is difficult to be recognized in the conventional world as it is, in a child with Down syndrome, it can be extra challenging because all of these signs and symptoms will just be dismissed as part of Down syndrome.
Yeah.
Right? That's diagnostic overshadowing, a term that you're probably familiar with, where physicians, practitioners, any clinician will attribute all of these signs and symptoms and ailments to just part of Down syndrome, right?
Yeah.
And this child will struggle for years, right?
Yeah.
Yeah.
And I've seen that a lot in the autism population too. I remember the first 3 kids in my practice, 30 years ago. One had nephrotic syndrome, one had hepatitis, and one had thyroiditis, but it was all in air quotes for those who are just listening and not watching. It was all just autism. So yeah, it's really uniquely challenging. That overshadowing is such a good way to put it. So I so agree.
Yeah. Yeah, I would say just about every child with Down syndrome, my son included, we've experienced it, right? Wow. As soon as the parents hear that term, they're like, it's kind of a relief, like, oh, that's what's going on. Yes. And then we, look at things differently. Yeah. So yeah, it's tricky. Yeah, for sure.
And, like we say in so many of these kids, genetics may load the gun, environment pulls the trigger. And,
Yes.
and when it comes to PANS and PANDAS, there is a genetic predisposition. And unfortunately, our kids may have the genetics for several different things. But that doesn't, just because they have Down syndrome, certainly doesn't preclude them from also having PANS or PANDAS.
Correct. Yeah. Yeah. Yeah.
One of the challenging things in kids with autism and PANS, PANDAS is, often the perseverations, the OCD are there in the background, but also often agitation. And so sometimes the rage, aggression, agitation that may come with a Bartonella triggered
Mhm.
PANS or a strep triggered PANDAS is really hard to see. Does is that any different in the kids with Down syndrome or still very, very similar?
Yeah, there's a stereotype of Down syndrome that they're pleasant and happy all the time, but that's not the case, right? Some of my kiddos, parents are really struggling with aggression, anger. And one of the phrases we have in our community, I'm sure it's in others, is, behavior is communication. And
Yeah.
if there's a child who maybe isn't great at expressing themselves verbally. Maybe they don't have any ability to express themselves verbally, right? If they are in some kind of discomfort, whether it's a headache, right? Maybe that's neuroinflammation, maybe it's dehydration, but a headache, a stomach ache, right? Constipation, right? Some kind of discomfort that often comes from inflammation and these, infections, and it can express as aggression, sometimes self-aggression, sometimes aggression towards others. And I always see that as some kind of physical ailment.
Yeah.
Nobody wants to be aggressive. Nobody, regardless of their cognitive abilities, what have you. Nobody wants to behave like that. There's always an underlying medical, physical cause, and it's our job to find it, right? And not to just say, this is behavioral. I hate that, Nancy. This is
I know.
behavioral. They're just being stubborn, right? That stereotype, right? And so we dig, right? We're looking at iron and gut health and why is this child behaving this way, right? So yeah, and we often find it, right?
Yeah.
We often find it when you run the right tests and you know what to look for, as you do and we do, we find it. So yeah, so it's not just Down syndrome. Yeah,
Yeah. And
yeah,
as my mentor, Sid Baker, always said, have we done enough for this child? And unless we're being
yeah,
detectives and leaving
yeah,
no stone unturned, we haven't done enough,
yeah,
so.
yeah. We've kind of have a motto in our office, and it's what else, right? Like if you have a child who's tired and you find a low iron and you say, oh, I found it. Their ferritin is 12. That's why they're tired, right? That to me, I call that medical tunnel vision. I don't know if that's my own term, that you just see that one thing and you're done. But we're
Yeah.
always like, well, what else, right? Why are they low in iron? What else are they low in? And if they're low in iron, what else are they low in, right? And so there's
Yeah.
always that what else? Yeah,
Yeah.
yeah,
Yeah.
yeah.
And you talk about the gut and iron, and how does the immune system in children with Down syndrome differ in terms of its development, its function, its response to infections or other things?
Yeah, there's research to show that there's a common tendency, and that's a really important word that I use a lot in my practice, is a tendency, right? It's not all children. They're
Okay.
all unique. That's a whole nother conversation, but they're all unique. But there is a tendency towards elevated inflammatory markers, IL-6, TNF alpha, right? The research shows, of course, then, it's assumed that they all have this, but there are other underlying causes for that in terms of gut health and diet and the like. But there are some genetics, right, that are involved in the upregulation of some of these cytokines and inflammatory markers. So there can be, a little bit of underlying inflammation that is fluctuating, but, kind of higher than the typical population. So that's a difference in their immune system. There is a lower rate of antibody production, just the ability to fight infections, lower rate of response to vaccines, right? There's research out there to support that. And so I've always, my is why. Right? Why is that? What is it? Because there's nothing on the extra chromosome, to my knowledge, that would kind of drag the immune system down to that degree in so many of our children. So it kind of alludes to what I lectured at MAPS on in the fall, was on immunometabolism and their metabolic rate. And when I learned that term, that's a thing, immunometabolism, that there's an intersection there. First
Yeah.
of all, it was a kind of a duh moment, right? And I have a social media post on this. When we're tired, our immune system is tired. And so there is a tendency for a lower metabolic rate tendency in our kiddos with Down syndrome.
Yeah.
Why is that? That's complex itself. But the immune system is very energetically active. It requires a lot of energy to fight infections appropriately. And when it doesn't fight infections appropriately, we get, maybe some neuropsychiatric symptoms, some autoimmunity, right? The immune system can kind of misfire, is more likely to misfire, as research tells us, when the
Yeah.
metabolic rate is low. And then we know that PANS is an autoimmune condition. We have a higher rate of autoimmunity in our children with Down syndrome, thyroiditis, celiac disease, type 1 diabetes, et cetera. And so a lot of that is tied to their metabolic rate, which again, I could lecture for hours on, as you could, on mitochondrial function, glucose metabolism, nutrient deficiencies that are, needed for the metabolic state of our bodies. So it's complex, but doable, right? We can increase the metabolic rate of our patients so they can fight infections better, not just throwing herbs and things which have their place, right, to fight infections, but looking at the patient, holistically, and why aren't they able to fight these infections appropriately? And then, of course, prevention in that area is key. So they have some unique immune challenges. I'll just close that with that Down syndrome in some papers has been termed an immunologic condition, right? And a condition of immunodeficiency, right? And then all of the sequelae from that. So some unique challenges, but they can be overcome and, optimized as best as we can to prevent these things. Yeah.
Yeah. And it brings up a very important point. I lecture all the time that PANS and PANDAS are a clinical diagnosis. But especially in
Yeah.
this kids, as in all kids with PANS and
Mhm.
PANDAS,
Yeah.
there are a group of children who are immunodeficient. It's at least 30 to 40%, but especially in these children with Down syndrome, when they're immunodeficient, you may not see an appropriate antibody response. So when
Yes.
people say, oh, the strep titers were normal, it can't be PANDAS, or, oh, I didn't see any mycoplasma or viral titers or whatever else
Right.
it may be, that
Right.
immunodeficiency may cause them not to be able to mount those antibodies that we're looking for. So
Yeah.
again, in this group of kids, it's also really important to keep in mind that this is a clinical diagnosis, right?
Yes, absolutely. Right. We do, one of the mainstays of functional medicine is labs, right? We do kind of lean on labs a little bit. It gives us a lot of information, but we have to look at our patients too. And sometimes the labs don't always give us the information that we're looking for, right? And we have to go to signs, symptoms, our years of experience and knowledge and what to do in these situations, and the labs don't always kind of reflect what we're looking for. So it's
Yeah.
true.
Yeah. It's our N of one. It's the kid in front of us.
Yes, exactly.
So,
Yeah,
and what strategies do you use in your practice to optimize this metabolic and immune
yeah.
function in this population of kids?
Yeah, I do a lot of organic acid testing, as you have like thousands of organic acid tests on these kids, and just love that test, right? There's so much information we get from an organic acid test, but one of the most important things is mitochondrial markers on an organic acid test. And again, I don't always see them elevated. When they're elevated, it means that there are missteps occurring in, the citric acid cycle, et cetera. I don't always see that in my kiddos, right? There's research to show that there's mitochondrial dysfunction exists in Down syndrome, not always, but many of them. And so for a tool, the organic acid test is a big one, because then I can see exactly where in mitochondrial function are we missing a step. I do often see one of the very first steps is what we call the key to the front door. Pyruvate dehydrogenase is the enzyme that allows glucose to sort of enter the mitochondria. And I often see a misstep there. Again, not always. I'm going to say that multiple times, but thiamine, so thiamine deficiency is a common one in our kids. And when we look at the signs and symptoms of thiamine deficiency, we see speech issues, gait issues, low muscle tone, right? And this, I know, Nancy, our kids, there are children with Down syndrome out there right now, and adults who are experiencing Wernicke-Korsakoff syndrome,
Yeah.
overt, frank, and it's just being dismissed as Down syndrome. So thiamine deficiency is a big one. I won't harp on that one too much, but
Oh,
that,
I wouldn't mind you harping on that one a little bit.
yeah,
I watched
please.
some of your
Yeah.
videos on the YouTube channel on so many
Great.
different things, the
Yeah.
thyroid, the mitochondria, the microbiome. But talk a little bit more about the thiamine deficiency, because I don't think a lot of people really
Yeah.
understand that.
Yeah, so thiamine is vitamin B1, and it's a cofactor for obviously multiple enzymes, but one of the key ones is this enzyme that really allows glucose to enter into the mitochondria. This enzyme, pyruvate dehydrogenase, is dependent on other B vitamins, B2, B3, alpha lipoic acid, and the deficiencies in these nutrients can occur in these children secondary to malabsorption. Malabsorption is so
Wow.
huge in this population that is underdiagnosed, undertreated, underrecognized, under-researched, right, in these children with Down syndrome. And the reason for the malabsorption of thiamine, and we can go over signs and symptoms really quickly of that, but the reason for the malabsorption is slow gut motility. And that slow gut motility is an aspect of low muscle tone that children with PANS, PANDAS, other genetic conditions, right? We see children with other genetic conditions. When there is slow gut motility, any kind of GI stagnation, they can be pooping every day, right? But if there's any signs, any little reflux, any little bloating, right? Boom, that's malabsorption. That's SIBO, small intestinal bacterial overgrowth. Yeast overgrowth, especially in
Yeah.
light of lots of antibiotics. Oh my gosh, Nancy, I've had 3 and 4-year-olds who've been on like 12 to 15, 20 antibiotics in their life. Antibiotic after antibiotic after antibiotic.
Yeah.
And so they're going to have yeast overgrowth, and that will absolutely create a thiamine deficiency. There's no doubt about it. And then that thiamine deficiency will perpetuate the slow gut motility, perpetuate the neurological issues, and then they will just decline very quickly, and it's all attributed to their genetics. And so we've seen some remarkable turnaround in children when we find the underlying cause, treat the SIBO and the yeast overgrowth with the appropriate herbs, is my tool of choice, and then address the nutrient deficiencies that the organic acid test shows. And we see remarkable improvements in their gross motor skills, their speech even.
Right.
Yeah,
I've
and
seen speech be a big one with treating
thiamine.
thiamine deficiency.
Yeah, yeah,
And
absolutely.
what you're saying about finding the underlying root cause of even that, why are these kids,
Yeah.
zinc deficient or iron deficient or
Right.
thiamine deficient, not just adding that supplement to treat that, but
Mhm.
going even deeper and looking at why the malabsorption, why the
Mhm.
slow transit time, et cetera. So,
Mhm. Yeah,
um, do you want
yeah.
to
But
talk
all
about,
that's going to affect
go
their
ahead.
immune system. All that's going to
Yeah.
affect their system too, to get back to, yeah, right. Yeah.
Absolutely. And it's all interrelated. And it's like putting the pieces of a puzzle together.
Yeah.
It really is.
Yeah.
I love puzzles. So anyway.
It's so funny you say that. I'm literally looking at a big puzzle I'm working on over here. I love puzzles as well. And I think it ties to the work that we do for sure. That's interesting, Nancy. Yeah.
Yeah, it really does. It really
Yeah.
does. It's what I do every morning. I do puzzles on my phone. I have puzzles
Oh,
on
that's
my
great.
table. And it was something
Great.
my mom gave me years ago, was
Yeah.
this
Yeah.
love of that.
Yeah.
So
We have a mutual
um
hobby.
yeah, but you talked about the symptoms, the signs of thiamine deficiency. Just elaborate on that a little bit more before we move on from that.
Yeah, absolutely. Starting in infancy, it'll be a child, an infant who's more quiet, right? Doesn't cry as much, right? Which is lovely for parents, but not the best, right? We want kids who are kind of rowdy and, make their needs known. Delayed gross motor skills, right? A child who isn't walking at 2.5, right? There are plenty of kids who have Down syndrome who do start walking 18, 19, 24 months. I know that's delayed for typical population, but in Down syndrome, we're happy with 18, 19 months. That's great when they get up and start walking eventually. But if they reach 2.5, 3, right, there's something more going on, right? And that can be a thiamine deficiency. So delayed gross motor skills, infant who's quieter, constipation, reflux, ophthalmoplegia. So
Oh, right.
if their eyes are crossing, and I see this all the time in our kiddos with Down syndrome, if their eyes are crossing, that can be a B6, a B12, or a B1 deficiency because of the extraocular muscles are driven by the cranial nerves. I think it's abducens and the cranial nerves. I can't remember. And so that will be affected by a B1 deficiency, ophthalmoplegia for sure. If I get a parent who reports, oh yeah, their eye started turning in, I'm like, we're going to start some B1 and we'll run some tests while we're waiting for the results. We're going to start some B1. So that's a big one. Oh, and then just choking and swallowing issues, right?
Mm,
So many of our kids with Down syndrome experience. I've got a number of kids, lots of kids who are on G tubes, right? G tube
yeah.
fed because they just cannot manage the food. They're aspirating, right? They're on thickened liquids. That can be from other B vitamin deficiencies, but it certainly can be from B1 or B2 deficiency. And so we want to get in there and address that and not
Yeah.
just put them on a G tube and, give them Similac.
Yep. Yep.
So, yeah. Yeah.
And again, the interrelatedness of everything, as you mentioned, so much of this is related to the mitochondria and treating the underlying mitochondrial deficiency with the ophthalmoplegia, with the B vitamins. I mean, the B1, certainly B2, B6, B12, everything you say, but I'm also looking at other parts of the mitochondria, like you said, in the organic acid test and regular blood tests, conventional labs like carnitine and acylcarnitine. Do you also do those in this population?
Yeah, 100%. As you know, the fatty acids and the organic acid test will tell us if there's a need for carnitine and succinic acid and CoQ10, et cetera. But you can do those in conventional labs. You can run a carnitine panel, and we've picked up frank carnitine deficiency just from a blood test. And that will, of course, greatly impact their muscle tone, gut motility. I think there's a paper on just that of children who were, significantly delayed, had experienced carnitine deficiency, and it contributed to their constipation. There's a lot of good papers on that. So that's a really obvious one. So yeah, certainly looking at other mitochondrial nutrients for sure. Oxidative stress, of course, affecting the electron transport chain. So yeah, addressing as much as we can to support mitochondria from many angles.
Yeah. And, for the parents that are listening, it sounds like a lot, like just talking about it sometimes makes it sound overwhelming, but it's not. This is doable. Can you just address that a little bit?
Yeah, 100%. So it is complicated when we're trying to figure it out,
Right.
and the tools and the years that we've had doing this, but once you lay out a treatment plan and you point to parents that we just, get in there and treat the gut and we get these nutrients addressed, laying out my plan in a simple way is always my goal, right? We've got a lot of very busy parents we're working with. So yeah, it's, supplements are tricky, right? Tricky to get kids to take, as always. I'm sure you discuss that a lot on your podcast. But I don't like to throw the kitchen sink of supplements at my kids. That's why I like to test, so that I know if I'm going to give riboflavin to a kiddo, which does not taste good, I got to know for sure that kid needs that riboflavin, right? And so that's why those tests are helpful, so that I know exactly what I'm giving that kiddo is what they need. And yeah, it can get complicated. What they need can fluctuate. That can change over time. I don't want kids to just take, all these supplements for years on end, right? I pull supplements eventually, right? And once they're stronger and their bowel movements are better and their diet is better, we hope that, yeah, we pull these supplements. So so with the guidance of the right practitioner, those of us who are also mothers, right? We know that the practical everyday aspect of trying to give your child supplements, hopefully we can, we lay out an easy to follow plan of just what that child needs, and no more, no less, right? In my opinion. Yeah.
Right. And we do talk about how to give supplements, but do you have any tricks of the trade that you use that you found particularly helpful?
Yeah, syringes with mango juice is kind of one of my favorite juices. It's thick and sweet. We don't like lots of juices and sugars, but you got to get it in somehow. Using the syringe in the side of the cheek, not right on their tongue, following it with maybe a syringe of regular juice, so to kind of chase it. That's kind of one of my big ones. Never, of course, never ever forcing or pinning a child down. If I have a parent who emails me and I'm having trouble giving it, and I say, hey, tell you what, take a break for a week or two, right? Just step back, right? Don't panic, right? And then let's try again. Let's give your kiddo a break so they, don't lose their trust of you. Right. That's an aspect of giving supplements, or trust of their food. Goodness gracious. be horrible. So yeah, some of those are some tricks. Yeah. Peanut butters, or not peanut butter, excuse me, that's nut butters can be a way to hide supplements because it's thick. And yeah, there are others. Yeah, but those
Yeah.
are some.
And I
Yeah.
think what you said about taking a break and a pause, and I think that's so important for
Yeah.
parents to understand that no matter what, whether your child is flaring, whether your child won't take what you're trying to give them, whether they won't go to school, take a breath.
Yeah.
Whatever helps you to
Mhm.
just bring it back down a notch. Prayer, meditation, going for a walk,
Yeah.
and in this, like taking a break. And
Mhm.
also what I hear you saying is having the child be part of this. You're not forcing the child to do it. And I think this is really important in our older kids too. That
Yes.
whether they be contracts with the kids or, I do that a lot. Let's try this for X amount of time. And
Mhm.
you let me know. I know it tastes like crap, but let's find the
Yeah.
thing that you feel comfortable taking it in. And
Yeah.
that pause, that
Mm.
breath, that
Mm.
understanding, compassion is so important for all of our families.
Yeah, and I like that, getting the child involved, of course, again, just because they have Down syndrome, they understand all this, right?
Yeah.
That maybe this is helping them. We can call it medicine if you want to, but, getting a pill box for them that they decorate, that they, get some markers, have them decorate their pill box, get them involved. My son gets on my case if I don't have his vitamins filled. He's like, Mom, you got to put my vitamins in here. I need them. And so, yeah, so getting them involved, getting them invested, showing them that you are taking supplements also, right?
Yep.
Modeling that behavior can be really helpful. So yeah, lots of ways to kind of just bring it into the culture of your family, I guess. Yeah. Yeah.
Yeah. And when you say modeling that behavior, reminds me about modeling that with diet also, and
Yes.
and how important the gut is. And we've talked around
Mm.
it a little bit. A lot of people say the gut's the second brain. I think the gut's the first brain,
Yeah.
but talk a little bit more how gut health influences the overall health, the immune health, the cognitive development in
Mhm.
children with Down
Yeah, well, I mean, certainly I could just simply answer in the same as everyone else. But a lot of their gastrointestinal issues are, go unaddressed, as with many of us in, the conventional medical world. But, do they have a higher rate of, dysbiosis and SIBO and yeast overgrowth? Possibly, probably. Hard to say. There's a high rate of that in our population of kids in general with autism and PANS, pandas. But I would say that they do have a higher exposure to antibiotics, perhaps. They kind of go to the doctors more often. They have more chronic nasal congestion because their airways are smaller. Reflux will contribute to that nasal congestion. So, you go to the doctors more often, you're going to get the doctor's intervention more often. And the doctor's intervention is often antibiotics. And so that's going to take a huge toll on their gut health. I had a kiddo, and recently I heard was the doctor was going to put them on Augmentin for the rest of the year, Nancy, Augmentin. And I was like, that's going to take Augmentin. That's going to take a huge toll on the kiddo's gut microbiome that can have lasting effects, long term. We like to not think that they're irreversible, but sometimes they can be really long lasting, the effects from antibiotics. They have a place, they save lives, right? But they are certainly overused, which I think everyone would agree with. So a higher rate of dysbiosis, gastrointestinal issues, secondary to SIBO, yeast overgrowth, antibiotic use. And then diet, right? A lot of our kids have struggled with diet though, right? But if you can't get your child to eat certain foods, healthy foods, that's going to take its toll eventually on gut health, right? If they're just eating, yogurts and goldfish crackers and hot dogs, right? The microbiome isn't going to be happy about that. And then over time, that's going to make the ability of that child to eat those healthy foods even more challenging, right? So yeah, I mean, I'm in a bubble, right? So I could argue that, yeah, the gut microbiome and health of children with Down syndrome, many of them can be highly compromised. Yeah, for sure.
And are there
Yeah.
specific interventions that you use to support optimal gut health?
Lots of them, right? I mean, this is our toolbox, Nancy, right?
Yep.
This is the
Yep.
thing. Yeah, so all the things. I don't always give probiotics, a lot of them I don't. They have a place, of course, my gosh, of course, your lactobacillus GG, your rhamnosus, your, bifidobacterium to lower histamine and all those probiotics that we look at. But if I've got a kid with SIBO, I better be really careful with probiotics. So they have a
Yeah.
place, but I often pull probiotics from a kiddo. I use herbal formulas. I'm not sure if I can mention any here, but there's some very popular herbal formulas in our field that I
You're
often
welcome to mention them if you'd like to.
yeah, biocidin is a popular one. Grapefruit seed extract I use a fair amount for yeast overgrowth. I've seen really remarkable things with uva ursi. I use it for just a couple weeks at a time.
Yeah.
So I've got some of my favorite herbs that I use that are tricky. None of these taste good, right? We're going to kill bacteria. They're not going to taste good. But biocidin we use just in little drop doses, so that's helpful. So lots of herbs to kind of clear the whatever's occurring in the gut, to kind of reset things, and then probiotics, prebiotics, of course. And then other herbs, formulas, things with slippery elm, aloe, I use a lot. Aloe I
Yeah.
love for constipation. It's soothing to the gut. There's even at least one study that I know of that showed that it lowered thyroid antibodies, aloe.
Mm.
Um, so yeah, so all natural stuff is what I use really. In very rare cases will I use antibiotics. Yeah.
Yeah. Yeah. And I
Yeah.
think a couple of things that you said are so important. I mean, probiotics, I always use the analogy, it's like peeing in the ocean. Some people think, well, we're going to replace all the bad bacteria with good stuff by giving, one
Yeah.
pill or 1 teaspoon of a probiotic. And, that is literally peeing in the ocean.
Ocean.
But, we can stimulate peristalsis with good probiotics. We can increase immune tolerance with good probiotics. And I think one of the things that's a pet peeve of mine is when people say that probiotics that contain strep should not be given to kids with PANDAS. And
Right.
that there are some children that are sensitive, but there are very good studies that show that, for example, strep salivarius is a
Yeah.
great oral health augmenter and helps to decrease the seeding of the gut with your mouth germs, etc. And
Mhm.
and I think that understanding the place of probiotics and when to use them and when not to use them, and not just to
Mhm.
put that in and think it's a panacea, is a really good point. When you have
Yeah.
SIBO or SIFO, could actually make things worse.
Right, right. With any supplement, right?
Right.
That's another point I often make is every supplement that we put into our mouth or our children's mouth is going to hit their microbiome first. And I mean every supplement, and it can
Yeah.
affect that, right?
Yeah.
You give too many B vitamins, you can feed SIBO with your too many B vitamins, right?
Absolutely.
So yeah, so we're very careful with supplements when I recommend them. I'm very careful. But I love the mentioning of the oral probiotics, which is funny to say oral because you're swallowing them. No, the ones that you chew and yeah,
Right.
the salivaries. I consider those kind of a bio shield, right? That
Mm-hmm.
they're preventing things from getting in. And so, yeah, I use that a lot. Pro Kids ENT, there are a number out there on the market that are shown to prevent strep infections, right? When I've got a kiddo with repeat strep infections, it's not the only thing we use, but we're adding those oral chewable probiotics. Yeah.
Right.
Yeah.
And the other one I use a lot is fiber. I mean, there's a lot of good studies that show that fiber feeds the commensal bacteria. And, the studies in mold and tick-borne disease of like modified citrus pectin, reducing
Mm-hmm.
galactin-3 and glutamates. And so I think that, when I think about getting stuff into kids, I think about that kind of stuff. I use a lot of smoothies in
Yeah.
in my practice if kids will do
Yeah.
them, because you can throw a lot in there that they might not otherwise take and
Mhm.
hide it. So
Yeah,
to some degree.
especially, yeah, the smoothies for sure, especially the prebiotics. Yeah,
Yeah.
yeah. Yeah, I often recommend if I've got a kiddo where we're on kind of a maintenance thing, I say, hey, listen, why don't you give, if it's an older child, a couple capsules of fiber, a binder, right? Once a week, right? 2 nights, right? I've done this with my son, right? He's a teenager. I think he's pooping regular. I don't know. I'm pretty sure. And so every once in a while, if we've had a burger or something, I'll be like, hey, let's take some. He knows it too. He'll be like, Mom, where's the fiber? Pick a fiber and a binder. Let's just get a little bit of a 2-day detox and clean out a little bit, and that can be helpful for lowering histamine, which is high in a lot of kids with Down syndrome. Another immune system, autoimmune aspect, they have high histamine very often.
Yeah.
So we use binders, and that's another tool for sure, but careful with constipation. Yeah.
Absolutely. And speaking of constipation, I mean, I love aloe too. I mean, it is absolutely one of my favorite anti-inflammatories, anti-constipation, so to speak. But I learned once that aloe should be certified as aloe. There are a lot of products, at least here on the East Coast, that taste really wonderful. And when you look at the ingredients, there's a lot of sugar, there's a lot of water, and maybe the 10th ingredient is aloe. So I always look at good brands, good types. Do you have favorite aloes?
I don't. I look for organic is
Yeah.
often what I look for. Yeah. There is a brand, I can't think of the name. I check the box to send it off, but I'm looking for organic, but I need to do that more. But I know it's pure, it's aloe and doesn't have any other ingredients in it. So
Yeah.
yeah,
My
yeah.
son used to take it right
Important.
off the plant. Suck the, yeah.
Hardcore,
Uh,
hardcore.
hardcore. But George's, I like Designs for Health,
Oh
the
yeah.
pills,
Okay.
in kids that can swallow that. I think the liquid is much better, but
Mhm.
some of our older kids are
Yes.
done with liquids or they're away at school or whatever it may be. So.
Yeah, fair, for sure. Nice.
Yeah. And we've talked a little bit about our N of one and looking at the child in front of us and really trying to figure everything out. Why is it so important to recognize the individuality, the biochemical individuality of our kids with Down syndrome?
Yeah, they have, some shared characteristics for sure, biochemically, you could say with their features, of course. But when you think about it, the extra chromosome, I think this is calculated somewhere. I should have had this for this interview, but it's like 1% of who they are, right? But look, it's a far-reaching 1%, right? Huge implications, right? I'm not sugarcoating it, but it's 1%, right? There are 22 other genes, right, in our genome that are affecting our ability to process supplements, our ability to process, I mean, our SNPs and whatnot. So they have other genes, right, that are affecting their biochemistry, and they have different medical histories, different exposure to medications, different diets. I mean, you can't give a protocol, well, to anybody. Protocol to me is a 4-letter word. You have some things that we use in similar situations, but overall, for a person, I don't like protocols because of all these factors, right?
Yeah.
You can't you can't expect one child with Down syndrome to need the same supplements who's eating hot dogs and goldfish crackers to another kiddo who is eating the broccoli and the salmon and the quinoa and they're going to have completely different needs. Or the one child who was born C-section, not breastfed, got antibiotics in the NICU, another round of antibiotics later on in life, to the kiddo who was born vaginal delivery, breastfed, no antibiotics, went home with mom and dad, breastfed till they were 2, all that stuff, right? They're going to have completely different needs. Yes, they both have the extra chromosome, but they're going to have completely different needs.
Yeah.
So that's how I approach them, right?
Yeah.
And so I call what I practice. Hopefully, my book will someday be called Person First Medicine for Down syndrome, because they are people first. They are children first and foremost, and then yes, I consider their genetics and the role that those are playing and methylation and everything else. But yeah, they have so many other factors. Yeah, I could go
Yeah,
on and for sure.
I know, and I love that. We're both. I hate protocols. I love that that's a 4-letter word in your world, and and
Yeah.
and I didn't know a book was coming. Is it anytime soon, or this
No,
is a dream?
I'm working on, no, it is a dream. I've got it started. I'm working on publishing a case report, Nancy. I hope I can publish this case report and hopefully a case series on another topic that is linked to PANS and PANDAS, which is folate receptor antibodies. I wouldn't mind a couple minutes on that,
I
but I'm
would
hoping
love
to.
to.
Yeah. So we are seeing a high rate of these folate receptor antibodies in our kiddos with Down syndrome. And for those who are listening, right, as you know, the antibodies, they're blocking folate from getting to the brain, right? These are antibodies, they're blocking and binding. And we're seeing a high rate. Now, look, I'm going to tell you right now, I think I can say this. I've tested 15 families, have paid for the test. These are children who are struggling more significantly than others, which has always been the goal of my practice. Why are kids struggling more than others? Okay, another topic. Yeah. And so we've tested 15, 14 are positive, Nancy. I mean, that's,
Wow.
90%. So we're testing another 20 and waiting for results. And I've included some kind of typical kiddos with Down syndrome. So we're not skewing things and only studying the kids who are struggling more. But we have seen a high rate in my kids who have a dual diagnosis of Down syndrome and autism. Maybe they're non-speaking. They've had a significant regression, sometimes very significant. There's a condition called Down syndrome. It's going by a couple names: Down syndrome disintegrative disorder, which is exactly how it sounds. Down syndrome regression disorder often happens around puberty, and they literally just kind of go inward and they get almost catatonic. And it's very sad, of course. And we've gotten some kids, Nancy, back to baseline, right? Back to baseline, particularly with finding these folate receptor antibodies. Yeah.
Wow. And are you treating that with folinic acid?
Yes.
Yeah.
Yeah.
Great.
Absolutely. Yeah.
Yeah.
Folinic acid, leucovorin often. Yeah.
Yeah. And for those who are listening or watching that don't understand this, there's tremendous literature from Dr. Raymaker, Dr. Quadros, Dr. Rossignol, and Dr. Fry in the autism world, especially with the numbers in most of their studies around 71% of children with autism having these receptors, these antibodies at the folate receptors at the blood-brain barrier. And, Dr. Wells and I published the study this summer on kids with PANS and PANDAS. And the treatment for this is high dose folinic acid, up to 2 milligrams per kilogram per day in the children. And I think Dr. Fry goes a little bit harder and a little bit farther than I do. But, in that population, in just the PANS PANDAS kids, no autism, no dual diagnosis in our practice, it was about 63%. And small numbers, we only had about 47 that fit into that. But I'm thrilled that you're doing that and going to be reporting on it, because I think it's a really important, whether it be adjunct or comorbidity or whatever word we want to use, it's a really important finding in a lot of these kids with PANS PANDAS, with autism, and with Down syndrome once you get your cases reported.
Right. Yeah, exactly. Yeah. And going into those higher doses is, we will do that when we've got a kiddo with the known antibodies. But I have a number of kids who we're just doing trials with folinic acid. They can't do the blood test for a number of reasons.
Yeah.
And so we're doing doses of, I'll start out with the over-the-counter stuff and we'll titrate up, and kids in other countries who can't get leucovorin I'm working with, and they're reporting significant improvements in speech, engagement, et cetera, even with just trialing folinic acid. I'm not recommending parents do that on their own. Of course, under the guidance of practitioners is often more helpful, but we're seeing some benefits for sure just trialing it. Yeah.
Absolutely. And I think for those who can get the test, it's the folate receptor antibody test. And you can go to fratnow.org and find out more about it if you're interested.
It's I think it's .com.
.com. Okay.
Yeah.
Babe, you're probably right. But
no worries.
Anyway, try it. And the other thing I wanted to mention is one of the things that I learned was that although I was using methylfolate for like our MTHFR defect kids, et cetera, that if they have certain SNPs and if they have these folate receptor antibodies, that methylfolate can't get in, has to sort of go through a back door. So the folinic acid is really the way you get past this antibody. So I think that's an important piece too. But it bring up another question. You mentioned, the other 22 genes in kids with Down syndrome and the whole 23 in all of our kids. But what about the genomics? Do you do much in that field with these kids?
Yeah, really good question. I'll do that when I'm stumped, right?
Yeah.
When we've kind of reached the end. And I don't, and there's so many other areas of their health that I look at. So honestly, I've gotten away from those a little bit, right? Because of the work I do. I'm working with kids with a whole extra chromosome, right? And so I've learned that it matters and it has a place, but I want to see how the body's functioning. I want to do the emissions tests. I want to all the other things. And so, yeah, so I've gotten away from doing those, right? We were all excited about those, 10, 15 years ago. And I don't follow that, when there's a SNP, there's a supplement
Right.
for a SNP. I don't follow that. So yeah, I'll only use it when I'm really stumped. Or sometimes I can like assume, like I could carry on about like cases I've seen where I'm like, oh, I'll bet you've got a slow compt. I'll bet you've got an MAO SNP, you can
Yeah.
kind of see it in their tests, right?
Yeah. And I think that's a really important point. I think those of us who have been doing it long enough, we could
Yeah,
almost see what they're going to have as opposed
yeah,
to, and I also
yeah,
love, Liz Mumper well,
yeah.
and once I had to give a lecture sight unseen for her, and she had the MTHFR SNP up there as the Brangelina of SNPs. And I could not figure out what the heck she meant by that at all. But what she meant is that there
Hot
are
new.
hundreds
Yeah,
of thousands of SNPs, and
yeah.
we talk about MTHFR and the thing to do when they have that defect. And I think what you're saying is, number one, it isn't a one-to-one.
Hmm.
It's about the whole picture of the genetics, the genomics, the environment, the child in front of us that is so important.
Hmm.
And I so agree with you, to the one-to-one, this defect and this supplement just
Hmm.
is missing a much bigger and more important picture.
Yeah, absolutely. And sometimes I'll just make not assumptions, but I'll I want to call it universal precautions, right? I think we all should use methylfolate, varying degrees, right? Using our labs to kind of tell how much we need. Are they getting dark leafy greens in their diet, right? Where our
Yeah.
folate comes from, right? And things like phosphatidylcholine, if they have a PEMT SNP. I give all my kids, to be honest, phosphatidylcholine. That's the one supplement I like for all my kids. And so there are some things that I think we all should be kind of leaning into this. So yeah, universal precautions in some cases. I don't know if that's the right
Yeah.
term. Yeah.
I like that. I like that. And
Yeah.
you mentioned that phosphatidylcholine is one you always get, and I love that. I think that
Yeah.
cognitively, developmentally, in so many ways, that phospholipids in general are so important. Are there any others that you would say, hey, these are my top three or my top five? I'm using it a
Yeah.
lot in a lot of kids.
Yeah, that one's a big one for sure. There are studies looking at the cholinergic nervous system in children with Down syndrome. It's under functioning, and so we support acetylcholine synthesis. And choline is one of the ways we make acetylcholine. So that's number one. Fish oil I often use, but I'll pull it if I've got a kid with a histamine issue, and I don't know
Yeah.
about how that fish oil's been sitting there, if it's been, if there's any histamine in there. But fish oil is a big one for sure. And beyond that, I don't do everything. I don't really have anything, right? Sure, we've got our anti-inflammatories, our curcumin, we use, SPM active if need be, the pro-resolving mediators for inflammation. But you know what? The one thing I would do for all kids is focus on diet. I have an interview online of a woman named Karen Gaffney.
Yeah.
She's in mid to late 40s. She has
I
Down syndrome.
watched it. Yeah.
Oh, lovely. Oh, thank you.
Yeah.
And it was a longer interview than that, but I interviewed pre-COVID and then COVID happened. And I was like, look, I just got to get this one little piece out. And she took no supplements. And, she went to college, high school, TED Talk, swimming, right? The whole thing. And so, but she took no sup. I mean, she takes a little something. I left that what she does take in there because it's, kind of a little something. And so so diet first. She had a healthy diet and exercise. Yeah. So
Yeah.
that's what I would
Yeah.
do for all kids. Yeah.
And that's what she said, and I think the more we can help our families manage lifestyle things, diet,
Hmm.
exercise, sleep, good pooping,
Hmm.
breathing, the
Yeah.
more we can all be healthy, because our kids, whether they have PANS pandas or autism or Down syndrome. They're there to help us. We want them to be healthy, but maybe in helping them to be healthy, it can help all of our families be healthier too.
Absolutely. Yeah,
Yeah.
absolutely. Yeah.
Anything, I could talk to you for hours, and we'll have to do it more. We'll be at MAPS together in Myrtle Beach. Yes.
Yeah.
Are you coming?
I'll be there in the fall. I'll be there in
Okay.
the fall.
All right. I'll
Yes.
see you there. But anything you want to leave our listeners and viewers with? Any pearls of wisdom or anything?
Yeah, I think that one of the key things that I like to encourage parents is keeping your expectations high for your children, and not only in their, gosh, I get emotional, Nancy, not only in their the trajectory of their child's life, their expectations for school and their independence someday, but also their health, right? And if we keep our expectations high in their health, which is my kind of arena and where I'm trying to help these children, we'll be able to see when things slip, right? If we expect them to be unhealthy, we're not gonna kind of react like we should when something happens. So keep your expectations high in all areas, and don't let any doctor, anybody ever tell you what your child's future will be like. No one can predict your child's future. Don't let them tell you what your child can't do, right? Focus on what they can. Keep your expectations high in all areas. Yeah, especially health. Yeah. Yeah.
And that's a great point for everybody, whether they have Down syndrome or not. And in our families with PANS and PANDAS, there is hope. Keep your expectations of healing high. So,
Yeah.
and I know you've done that with your own son, and he's amazing. So
yeah, thank you. Thank you. Yeah, I agree.
So, yeah, I know. And how can people find you, Erica, if they want to look for you?
Well, we have a website, Peirson Center, PEIRSON Center.com. And then I'm on Facebook and Instagram a little bit. I do have a Facebook group, Person First Medicine for Down Syndrome is my Facebook group. We have a few thousand families in there. And I share, I don't hold anything I do secret. I try to help families who can't, come to see us personally. And so those are some ways that people can find us. Yeah.
Well, that's great, Erica.
Yeah.
And you have such a wonderful soul, such a wonderful practice and family. And I really appreciate you doing this with me. So thank you.
Thank you, Nancy.
That's it for today's episode of Demystifying PANS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS.